testing in the places where people are most likely to get infected. As scary as it is, given the kinds of numbers that we see when those most impacted facilities start to get tested, as scary as it is, testing in those facilities where people are most likely to get infected is how you deal with this as a public health matter. That's how you start to protect people who live in those facilities who are the most vulnerable to getting this thing and the most vulnerable to dying from it. That's how you target care and resources and ultimately protective gear to those places. You have to know where it is and who's got it. And you've got to protect people in those facilities who don't yet have it, who are at grave, grave, grave risk of getting it. This also, incidentally, is how you learn what you need to know to protect the community, the local community near those facilities from what will be a non-contained community-based outbreak there soon. None of these facilities is an island. No prison, no jail, no nursing home, no meatpacking plant, no freaking cruise ship once it's docked. If you've got an outbreak of this virus, it is an outbreak that will leak beyond the boundaries we are comfortable thinking of it residing within when we talk about it most hitting nursing homes, prisons, meat plants, these other kinds of facilities. We like to think of those outbreaks as being contained in those spaces, but this is a highly contagious communicable disease, right? Just because it starts spreading somewhere kind of off the beaten path or a place you don't usually think about, like a big industrial plant or a nursing home or a place where a lot of immigrants work and you don't know them in your community because they keep to themselves. I mean, just because these facilities and these types of places, prisons and jails and all these places may be liminal to us. They may not be in our constant view unless we've got family members there or who work there. Just because these are liminal facilities that are not visible to us does not mean that these outbreaks are going to stay in those places. That's not how it works with highly contagious communicable diseases. Take, for example, Cass County, Indiana. Earlier this week, you might remember we mentioned them on the show because Cass County, Indiana got our attention. Local commissioners there proclaimed a serious public health emergency specifically for that county. And this is not like the emergency or the disaster that everybody declared at the start of this thing so they could qualify for funds. No, they declared a new public health emergency in that county, and the declaration had teeth. It established serious new restrictions on what people can do in that county in terms of social distancing, far stricter than what people are restricted from doing in the statewide order in Indiana. Well, why did Cass County, Indiana do that? Well, they do have a Tyson meat plant in Cass County, Indiana, in Logansport, Indiana. And they knew they had some cases there, just like a lot of meat processing plants do. But the county officials there were smart and thinking ahead. Because sure enough, it is just a couple days later now. And today the county has announced the results of what they insisted must be the universal testing of workers at that facility. And it turns out when you universally test all the workers at a meat plant that's got a bunch of known cases, Katie barred the door when it comes to actually getting the total number, when it comes to getting the universal testing result. Turns out at that one plant, there are 890 positive cases at one plant. The local hospital, I should mention, in Logansport, Indiana, has a total of 83 beds, 9 beds set aside for COVID patients. They are all already full. They have 8 ventilators there in the hospital in Logansport, Indiana. 890 positive cases just among employees at the one plant in town, let alone any other cases that now may exist in the county tied to each of those 890 employees.